Hundreds of UNLV students are getting involved in the fight against the pandemic.
13 news anchor Tricia Kean looking at how the Southern Nevada Health District is putting these students to work, helping to keep all of us safe.
We had almost 1,000 applications that were submitted to us. So there were a lot of people who were interested.
Graduate student Casey Barber is a manager with UNLV's contact tracing team. Thanks to a $3.4 million grant from the state of Nevada, her team is hiring 200 students to help the Southern Nevada Health District.
We start from scratch to get them oriented about COVID-19 so they're familiar with all of the information they need to know.
The students are being trained as contact tracers. Their job is to interview Southern Nevadans testing positive for COVID-19 and identify who else they may have infected. It's a job where time is of the essence. COVID patients are typically contacted within 24 hours of being identified.
It's of course not pleasant for that person that we're calling, right? You're receiving a phone call from someone that you don't know saying it's calling from the health district. So sometimes people get afraid.
Graduate research assistant Christina Mielowski is on the team training new hires who undergo simulated phone calls with supervisors, learn new software for tracking data, plus learn how to be HIPAA compliant while collecting sensitive information like names and birth dates to verify a person's identity.
The goal is to reach as many people as we can because we are working on the intervention to slow the spread of the virus. So sometimes for just one case, it takes a lot of time, like an hour or 2 hours, depends on the number of contacts, places of exposure, etc.
The newly hired contact tracers work part-time while still going to school. Altogether, the team makes calls 7 days a week and speaks 16 different languages. Casey says along with collecting essential data, they're also there to help the patients.
We try to just walk them through it and ask them particularly what symptoms they've experienced and help them identify contacts that have been within 6 feet of them for 15 minutes or more in accordance with CDC guidelines, and then also answer questions that people may have.
In the end, Christina says it's also a great learning experience for the students involved in the effort.
It's important because they will definitely learn more about the outbreak investigation and infectious disease control and prevention. This is something new for the whole world, so we don't know what might happen in 10 years from today. So we will have a generation that will be prepared to help the community if, God forbid, something like this happens in a decade from today.
For 13 Action News, I'm Tricia Kean.